Hi, everybody, and thanks so much for joining us this evening for our third installment of the MyIBD Learning Partnership Program Monthly Series with the Crohn's and Colitis Foundation and Orlando Health. My name is Kaylee, and I'm the specialty dietitian with the Orlando Health Digestive Health Institute Center for Inflammatory Bowel Disease. And tonight I'm going to cover what to eat when you have an ostomy. I'm going to review what exactly is an ostomy and the different types specifically of intestinal ostomies. I'm going to highlight the various components of an ostomy care team and the basics about what to expect after surgery with emphasis on lifestyle and nutrition. I'm going to outline the nutritional implications of having types of ostomies, and I'll discuss general healthy eating tips and strategies to manage ostomy and output. I'm also going to review how to avoid complications and then finish things up by providing some local and national ostomy resources. So let's start with what exactly is an ostomy. So an ostomy is actually a very general term used to describe a surgically created opening that exists between the inside of an organ and then the outside environment. Tonight, I'm going to focus on intestinal type ostomies, which are most applicable to inflammatory bowel disease. And intestinal ostomies, as I'll go over, they get their name depending on where they originate from in the gastrointestinal tract. So when referring to intestinal ostomies, ostomy surgery basically is a process that allows bodily waste, in this case it would be stool, to pass through a surgically created opening or stoma on the abdomen into a prosthetic known as a pouch or an ostomy bag that's worn on the outside of the body. So the stoma, that surgically created opening, is a small hole that will exist in the abdomen. It's typically about the size of a quarter. It appears pink, kind of shiny and moist in appearance, and protrudes slightly outside of the abdomen. And that's what will empty into that prosthetic, the ostomy bag or the pouch, which is an appliance that you wear on the outside of the body to collect that stool. The ostomy bag is typically worn throughout the day and is something that you would have to empty several times throughout the day. Ostomy surgery typically occurs when, unfortunately, inflammatory bowel disease medical therapy, so medications, are not completely successful in controlling disease-related inflammation, or unfortunately, ostomy surgery occurs when complications arise in IBD care management. So let's go over the different types of ostomies. Like I had mentioned, the names of ostomies get their names from essentially where they originate from in the gastrointestinal tract. So when it comes to the small intestine, this middle portion, there are three portions. The first part of the small intestine is the duodenum. The second portion is the jejunum. And then the third portion of the small intestine is the ileum. So jejunostomies are essentially ostomies that are created through an opening in the abdomen using the jejunums, the second part of the small intestine, to create that stoma or that opening. And subsequently, an ileostomy is a surgically created opening, a stoma that's formed out of the ileum, that last part of the small intestine. Similarly, kind of following that trend, right colostomies, transverse colostomies, and left colostomies occur due to stomas or openings that are created out of those corresponding portions of the colon. So either the right, the transverse, or the left colon, respectively. So having an ostomy surgery is a big decision. It's a big lifestyle change, but before, during, and after your surgery, typically you're assigned an ostomy care team, which is a multidisciplinary team, as you can see on this slide, that will help teach you how to care for your ostomy and kind of teach you what to expect before, during, and after surgery. This typically consists of a gastroenterologist, a surgeon, and then an ostomy care team. Sometimes this is an OMS or an ostomy management specialist, or a WOCN, a wound ostomy and continence care nurse. These specialists really focus on the treatment of skin, chronic wounds and ulcers, ostomies. So they'll really be focusing on the care and site management of that ostomy. And then typically the care team also consists of a number of other allied healthcare professionals, including registered dietitians. So collectively, this team will exist to help answer your questions, provide training, and kind of give you an overview of what that process is going to look like leading up to and following surgery. So just kind of some general what to expect after surgery. It's really important, even leading up to surgery, to talk to your healthcare team about what you can expect after surgery. Everybody's recovery process is going to look a little bit different, but for most people, it'll take a little bit of time, so be patient with your progress. But in general, most people do quite well after their surgery and are able to return to work and normal activities after they recover. But it can take an adjustment period. Sometimes it's up to a year in some individuals. But typically following surgery, your healthcare team might restrict physical activity, sometimes for a minimum of 6 weeks. It might be a little longer, might be a little shorter, especially depending on the type of surgery that you had. Typically after surgery as well, patients can expect to be on a liquid diet for at least the first few days after surgery, and then slowly transition to a soft, kind of bland diet. And that's just because after surgery, it can take a little bit for output. So the stool that's coming out of the stoma into the bag, that output to normalize a little bit. So we definitely want to avoid any potential triggers. So foods that might be too fatty or spicy or chewy or tough. And so typically patients are put on a low fiber, soft, bland diet and counseled on chewing food well, making sure that we're avoiding foods that might trigger any undesired symptoms or change in output, and then making sure that we're really staying hydrated well. So we're going to cover now some general, tips on living with an ostomy with an emphasis on nutrition. So in general, caring for your ostomy after surgery, you'll work with that multidisciplinary care team, like I had mentioned, to learn how to care for your ostomy. So that's going to cover how to change your ostomy appliance, how to care for that skin around the stoma, how to manage and avoid leaks, how to manage and record output through that stoma bag, how to manage odor, manage dietary changes. Typically the appliance, so that bag, it has a wear time of about 3 to 7 days, although this might vary from person to person. And typically it's emptied about 4 to 6 times a day. That might be a little more, that might be a little less, depending on your body and your ostomy type. Ostomy appliances are also going to vary from person to person, particularly depending on the type of ostomy. Sometimes it's a one-piece appliance, sometimes it has a couple of different pieces. So again, that's going to vary from person to person, and why you're assigned a care team to help teach you those ins and outs. Odor control is a very common concern, particularly for our colostomy patients, because of the bacteria that naturally live in our colon. They can contribute to some of that odor producing quality. Some general tips, though, include making sure that your pouching system is a good fit and that you empty it regularly. So not waiting until it's completely full to empty that bag, but instead being proactive and emptying it as able when it's a third to a halfway full, because when you wait to empty, essentially the weight of that output will pull on the bag. It can actually loosen the steel around the stoma. It can cause some air and subsequent odor to leak out. It's also important when we are making dietary changes that we're monitoring our body's responses to food. So gradual changes are generally recommended, especially with our new ostomies. That way we can really monitor our response and kind of play with that a little bit. Unfortunately, for some individuals, it's a bit of trial and error. Some of the more common culprits are foods such as broccoli, beer, cauliflower, garlic, onions, fish, aged cheeses, and we'll go over some of the odor producing foods to maybe limit versus odor controlling foods to maybe incorporate when we go over food choices. Additionally, odor eliminators can sometimes help control the odor inside the bag. These include products like deodorizing, tablets, drops, even gel sachets. We definitely recommend, though, only using products that are specifically designed for use in ostomies. And then additionally, sometimes pouches are designed with an odor reduction filter. Typically, this is charcoal infused. And so that helps actually filter the air that might leach out or escape the pouch, kind of trapping some of that odor producing quality. Managing output. On this slide, we're going to cover just some of the general dietary considerations to keep in mind for how we can maintain consistent output. But in later slides, we're going to go over really how to help manage higher than normal output. In general, especially with a new ostomy, it can sometimes be a little easier to manage or create more consistent output by eating smaller, more frequent portions throughout the day versus large meals all at once, or skipping meals because of decreased appetite. So kind of consistently eating throughout the day, even if that's more snack sized portions, would be desirable to kind of keep on that consistent intake throughout the day. Avoiding triggers that might create higher than normal output, which would include really sugary baked goods, sugar sweetened beverages. Anytime we consume anything too concentrated, especially in the form of sugar, our body's reaction is to actually pull water into the gut to try to dilute. And by doing that, it can actually cause increased output in the stoma because it's contributing to kind of diluting that sugar intake. On the flip side, when choosing lower sugar alternatives, be mindful that sugar alcohols, which are commonly used to sweeten sugar-free food items, are also poorly digested, and for some, it can contribute to symptoms of gas and bloating and increased odor. So instead, if you're having a hard time with looser output or managing higher output, sometimes certain carbohydrates that are a bit on the starchier side can help add a little bit of bulk. If you're having a hard time with staying hydrated throughout the day, we'll certainly hit on some more hydration strategies later on in this presentation. But sometimes not drinking fluids alone and instead kind of pairing them with after you eat your meal can help reduce just straight liquidy output, or choosing rehydration fluids as an alternative to sports drinks or just plain water. But if you're really having a hard time managing your output, if your output is very inconsistent, or if it's consistently liquidy or higher than normal, those will all be reach out to your healthcare team. That way we can discuss, some of the underlying causes and talk about other management strategies we can be utilizing. So next, let's chat about nutritional implications of having an intestinal ostomy. So this is kind of a busy picture, but I think it's important to highlight the functionality of the various components of our gastrointestinal tract. As you can see, there's the stomach at that curvature at the top of the picture, followed by the three portions of our small intestine, the duodenum, the jejunum, and the ileum. As you can see, there's a lot going on in the small intestine. The majority of our vitamin and mineral and nutrient absorption occurs in the small intestine. So as you can imagine, if we have an ostomy that occurs higher up in the small bowel that bypasses portions of the small intestine, we're losing out on some of that nutrient absorption capability. In turn, you'll see in the colon or the large intestine at the bottom, there's a little less going on there, still very important in terms of its function, because the large intestine's primary function is actually fluid and electrolyte absorption. So you'll see the sodium, the chloride, and the potassium. So our colon plays a huge role in hanging on to fluids and electrolytes. So dehydration is a concern depending on how much of the colon we're missing out on based off of ostomy location. So let's break it down a little bit. Depending on the location of colostomies, which we had chatted about being based in various parts of the colon, dehydration may be more or less of a concern. So with the descending colostomy, that essentially involves a stoma portion being created out of the last part of the colon. So there's some surface area that we're missing out of on that last portion of the colon, the sigmoid or the descending colon, but for the most part, we're utilizing the majority of the large intestine or colon to help hang on to fluids, hang on to electrolytes. Most often, we're getting full use out of the small intestine, barring any past surgical histories. And so for the most part, nutrients are well absorbed. Dehydration isn't a huge concern, again, borrowing any other surgical or medical history here. So for the most part, the output that we would anticipate in this type of ostomy would be semi-formed to soft. On the other side, the transverse colostomy, so in the middle of the colon, that portion that kind of spans across the abdomen, sometimes we're bypassing up to 50% of the colon. So patients might experience more difficulty with hanging on to fluids and electrolytes. So consistency that we're seeing in the colostomy bag is going to be more semi-fluid to soft or pasty-like in consistency. With ascending colostomies, which occur in that first portion of the colon, we're sometimes missing out on 75% or more of that colon surface area. So we're starting to see a decreased ability to really absorb fluid and electrolytes. Dehydration is more of a concern. And consistency in these types of colostomies are typically looser, almost like a semi-liquid to very soft-like consistency. With our ileostomies, we are missing out on the full surface area of the colon. And depending on the location of the ileostomy, sometimes we're bypassing even portions of the ileum. If it's higher up in the ileum, we're missing out on the middle or last portion of the ileum. So we might also have difficulty with nutrient absorption too, particularly vitamin B12, which is absorbed in that last part of the ileum. So we have some concern for not only dehydration, but also some nutrient absorption impairment. Stool consistencies and these types of ostomies tend to be mushy to liquid in consistency. And so dehydration, nutrient absorption, these are all things that we would really want to counsel patients on managing leading up to and after surgery. The rule of thumb for these types of ostomies that's also applicable for colostomies as well is generally the thicker the stool, the more nutrients and fluids are being absorbed. So nutritional strategies that we can utilize to help retain or maintain bulk to ostomy output is going to be very important. So let's go over some general eating tips for success, given what we know about ostomies now. So in general, again, we had talked about kind of giving your body time to adjust after surgery. Sometimes there is an adjustment period for taste acuity and appetite to return to normal after surgery. Immediately after surgery, I had mentioned that most often patients are put on a liquid diet or that soft, bland, kind of restricted diet post-operatively. Sometimes that can be for a month, up to 2 months after surgery. But long term, the recommendation is to try to, get back to a semi-balanced diet. Again, within the constraints of your past surgical history. Some patients have had additional surgeries with resections leading up to this ostomy. So again, this is all within the constraints of your medical status and surgical history. But in general, we try to slowly start incorporating more fruits, vegetables, lean protein sources, whole grains as tolerated. Restructuring eating pattern can help with this. So sometimes it can be easier to eat smaller, more frequent meals throughout the day versus large meals. And then also restructuring the time of day that you're eating. So if you're having difficulty with having to wake up in the middle of the night to empty your ostomy bag or just high output nocturnally, sometimes eating your largest meal midday or earlier on in the day can be helpful just to kind of give yourself a longer window before going to bed. Or even just kind of following a regimen where you cut yourself off and give yourself at least a couple of hours before going to bed after your last bit of intake, or being strategic about making sure that you're eating something that can help act as a binder before going to bed. In general, including lean, protein-rich foods, so avoiding some of those fattier foods that can sometimes be odor-producing or contribute to inconsistent output. So, for example, if you're choosing animal-sourced protein like meats, trimming off some of the visible fat, and then also avoiding some of those other triggers that we had discussed too. So concentrated sweets like sodas or sugar sweetened beverages like juices or baked goods full of dessert or full of sugar. And then also when you are snacking throughout the day or you are eating throughout the day, being strategic about incorporating protein sources with each snacks or meal portions. So avoiding those empty calories of just eating things like crackers or bread, and instead being strategic about how you can pair a protein source with that. So instead of just eating crackers or a banana, consider pairing that with a smooth nut butter like a peanut butter, or eating crackers with, sliced cheese is tolerated, or maybe Greek yogurt and some soft fruit. Your body also thrives off of a regular routine or schedule for meals or snacks. Try to avoid to the best of your ability, to go long periods of time without eating or drinking. So emphasis on that small, frequent intake. Any type of change in our diet, especially coming off of a big surgery like an ostomy, I would recommend gradual change. And that goes with the variety of foods that you're eating. So try one new food at a time in small amounts, but from there, slowly increase the amount of foods that you're eating. So variety and volume. In general, too, another strategy that can help with tolerance includes chewing your food well, taking your time at meal times, so not rushing through meals. And remember, just digestion begins in the mouth. And then lastly, when it comes to even drinking your beverages and avoiding extra gas and that ostomy, which can be uncomfortable and sometimes contribute to odor, sometimes avoiding the use of drinking through a straw or chewing gum. Both of those actually pull small amounts of air into the mouth and can contribute to some of that gassiness. Working with the dietitian too can help kind of fine tune some of these strategies and just making sure that you're meeting your nutritional needs and supplementing as appropriate too. Both short term, coming out of surgery, and then long term as well. So in general, here are some tips for selecting foods. You'll see it broken down by category. You'll see some overlap between the gas-producing and odor-producing foods. So you'll see foods that are kind of notorious for producing some stronger odors, but then you'll also see some gas-producing foods as well, such as cruciferous vegetables, which are gas-producing in nature. So broccoli, cauliflower, Brussels sprouts. You'll also see carbonated beverages on there too as being gas-producing. Other fiber sources that can be a little tricky, like baked beans, which are typically gassy in nature. You'll see foods that on the flip side that can actually help control odor a bit. You'll see juices listed on there. I still recommend when choosing to use juice as a strategy to help control odor that we're diluting, because again, anything too concentrated in sugar can actually also affect output. You'll see in general some foods that can help thicken stool. We'll go over that actually in the next couple of slides, some of those starchy food items that you can choose to help manage output, and then subsequently some higher fiber or tougher foods that can actually put you at risk for obstruction, which we will also go into more detail. You'll also see on this slide a picture of an ostomy food journal. Sometimes patients find it quite helpful, particularly with new ostomies, to record intake. So what I mean by that is writing down what you are eating and drinking throughout the day, and that includes all of your beverages, all of your condiments, all of your sauces, the amounts of each that you're consuming, the brand names, how you're preparing them, what you're adding to them. And then kind of next to that, following a similar timeline, also recording any and all GI symptoms, and then the type and amount of output that you're experiencing. So recording consistency, recording volume, and recording color. And that can be kind of helpful to correlate how these different foods and dietary changes are affecting your output. So let's chat about how to avoid complications, because that is always the goal. So let's chat a little bit more about managing high output. As you can see on this slide, it's broken down by ostomy type, so colostomy, and then ileostomy. And the amount of output that we will, anticipate within a 24-hour day is going to vary based off of the location of the ostomy. We're going to see a little put or change in consistency depending on the higher up, we're going in the intestinal tract. In general, the medical definition of a high output stoma is going to be output that exceeds 1,500 to 2,000 milliliters of output within a 24-hour period. Now, what is causing the high output might vary. Sometimes high output can be temporary due to an infection or change in medications, can be due to active inflammatory bowel disease. It can also be due to diet. So communication with your healthcare team to really investigate the root cause of high output and how to best manage that is crucial. Now, a common question that, I hear is, well, how do I record output throughout the day? How do I know how much I'm emptying from my bag? And there's a couple different ways to really record and monitor intake or output, excuse me. So you can either use the container that most often is used here in the hospital. It's that measuring container that fits over the toilet seat that has kind of these ticked lines for measurement. Some patients will empty their bag over the toilet into that container and then record, dump, and flush. You could really do that with any measuring basin or measuring container that has ticked lines. Some patients also prefer estimation. So what can be a helpful strategy is filling your empty ostomy with water, filling it a quarter of the way, filling it a half the way, and then filling it 3/4 of the way, and emptying each time into a measuring cup and kind of getting an estimation of, okay, I know my ostomy holds X amount of volume when it's half full. That way, when you're emptying throughout the day, you can kind of get an estimation of, okay, I emptied it once and it was a quarter of the way full. I emptied it again and it was halfway full. And you can kind of keep track of your intake that way throughout the day. Some strategies that we can use from a dietary perspective to help add a little bit of bulk during times of high output are going to be those starchier foods. They can serve as binders and help absorb some of that extra water that might be contributing to high output. Those are going to be things like simple starches, white rice, bread, pasta, crackers, potatoes, bananas, applesauce, or baked apples if they're skinned, marshmallows as tolerated from a sugar standpoint, and creamy, non-chunky peanut butter. Especially during times of high output, we want to make sure that we're staying hydrated because we're losing fluids and liquid through that high output. In general, the recommendation is drinking 8 to 10 cups of caffeine-free fluid daily. But during times of high output, we might have to compensate and drink more. So that's why paying attention to the amount of output that we're experiencing is going to be key. It's also important that we're monitoring for signs of dehydration so that we're watching for symptoms such as dry mouth. We're monitoring for symptoms like dizziness, fatigue, decreased urinary frequency, darker than normal urine color, and instead aiming for that pale yellow or almost straw colored urine throughout the day. If you're having a hard time tolerating liquid intake throughout the day, like you feel like it's just going straight through you or actually contributing to higher output, sipping beverages slowly can help. Sometimes playing with the temperature can help with tolerance. Sometimes drinking something a little more neutral in temperature, like closer to lukewarm or room temperature, can be helpful versus ice cold. And then sometimes avoiding using a straw or drinking after meals when you have a little bit of food in your belly to help absorb a little bit of the fluid can be helpful strategies to improve tolerance. Keep in mind that there are foods and beverages that can actually work against us and dehydrate, particularly caffeine and alcohol. They do not count towards your fluid goal. They can actually dehydrate the body. So those are beverages and, items that we would want to avoid, especially during times of high output. Some beverages to try include, you can try diluted sports drinks, diluted fruit juices, rehydration drinks are going to be particularly helpful during these periods, however. So when I say oral rehydration solutions, I'm discussing glucose electrolyte solutions that essentially kind of take advantage of this ratio of sugar and salt and water that our bodies really like to hang on to fluid best. So these ORS or oral rehydration solutions help really kind of take advantage of this and can help improve hydration, help you hold on to fluid a little better. Keep in mind that during times of very high output, you're likely losing some electrolytes in that output. So it's important to really discuss with your healthcare team so we can make sure that we're not only keeping you hydrated through fluids, but that we're appropriately repleting some of those lost electrolytes as well. Particularly if you have a history of heart disease or kidney disease or diabetes, that would be another reason as well to reach out to your healthcare team, just because electrolytes and fluid balance and sugar intake, it plays an even more crucial role based off those medical histories. These are some recipes for how you can create your own oral rehydration solution. And there's also products listed on slide. Pedialyte, Drip Drop, and Liquid IV are three common products that you can find in the store and that typically you can add to water or come pre-bottled and ready to drink. So in all, these are some helpful strategies that we can use during high output, but then also to help with dietary tolerance, particularly while we're increasing variety in the form of fiber. So let's chat about that for a second. So there's two different types of fiber. We've actually already talked about soluble fiber in the context of how it can be helpful for helping create a little bit of bulk in terms of output. And that's because soluble water actually dissolves, it breaks down in water, it forms almost like a paste or gel-like consistency. So it's really beneficial for diarrhea sufferers or loose liquidy high output ostomies. It actually slows down how quickly things move through our gut, so it can actually help with absorption too. Some examples of these are going to be those binder type foods that we mentioned previously. So potatoes, white rice, white pasta, soft cooked carrots, applesauce, bananas. But on the flip side, insoluble fiber is not dissolvable in water. It doesn't break down. We actually don't have all the digestive enzymes needed as humans to completely break down these fiber types. So as a result, what our gut tries to do is it actually pulls water into the GI tract and it increases how quickly things move through our bowels. It can actually decrease absorption as a result and can be quite abrasive and rough on our gastrointestinal tract. Examples of these food items are going to be things like dried fruits, intact nuts and seeds, high roughage foods that are very crunchy, so like iceberg and romaine lettuce, corn kernels and popcorn, the skins of raw fruits and vegetables. These are the types of fibers that we generally counsel patients to avoid during times of active inflammatory bowel disease, immediately after surgeries, and then patients at an increased risk for obstructions following ostomy surgery. So let's chat about that. Patients, particularly with ileostomies, are at an increased risk for obstruction because that stoma, the opening that's created, is formed from the ileum, which just inherently is going to be a little bit more narrow compared to colostomies. The intestinal tract is less wide compared to the colon. So patients are already predisposed to be at a higher risk for obstruction. And certainly with colostomies, we would really want to make sure that we're chewing our foods well, that we're not consuming extremely high intake of insoluble fibers, but it is slightly more of a concern for our ileostomies and then also our less common, but jejunostomy patients as well. So typically we counsel ileostomy and jejunostomy patients to avoid those high roughage foods that I covered in that last slide that are going to be high in that insoluble fiber category. Those are going to be things like raw fruits and vegetables with the skin still intact, intact nuts and seeds. We can definitely consider preparation techniques that can help improve tolerance. So, for example, soft cooking our fruits and vegetables, peeling away the skin when we're able, avoiding the seeds of fruits and vegetables, finally chopping our foods. Outside of soft cooking, pureeing, mashing, really any way we can help break down our food, help break down the fiber, help our bowels with the digestion process before we even eat, that's going to help improve tolerance. In terms of other ways we can help avoid obstruction, making sure that we chew our food very well is going to be a very helpful strategy that shouldn't be overlooked. So if you're still seeing intact particles or chunks of food in your pouch, that means that you're not chewing your food well enough. Like we had chatted about previously too, it can be quite helpful to reintroduce foods slowly, but particularly foods higher in fiber, one at a time in small amounts, and titrate your way up. But I would still caution about reintroducing foods that are going to be quite high roughage. So those are going to be things like celeries, raisins, cruciferous vegetables, mushrooms, nuts, seeds. I would do so after discussing with your healthcare team. And then, of course, throughout this reintroduction process, monitor for signs of blockage. And what that would look like clinically is decreased output through the ostomy. Sometimes, even during times of blockage, we'll see very, very small amounts of just like straight liquidy output. Sometimes signs of an obstruction or blockage can also cause abdominal pain, cramping, nausea, vomiting. Those would all be reasons to reach out to your healthcare team if you have concern for an obstruction, decreased output, or blockage. So let's chat about how to avoid complication, because I think a lot of the dialogue with ostomies is the high output sides of things. So let's chat about how we can ensure regular ostomy output, so avoid constipation on the flip sides of things. So a strategy that we can use to help normalize and add some bulk to the stool would be making sure that we're consuming added fiber. For the average man and woman, that would look something like 25 to 30 grams of fiber a day. Although a lot of this is going to depend on the location of your ostomy, the type of your ostomy, and then any past medical or surgical history. But so that can be discussed with your healthcare team what your exact fiber goals should be. In general, the recommendation is still going to be to increase your fiber intake once you're medically cleared after surgery. This is not immediately post-operatively. This is long-term. How can we avoid complication? So once you've received medical clearance post-operatively, I would recommend gradual increase of fiber intake. And what that looks like is just several grammed increase increments at a time. So not jumping from very low fiber to high fiber overnight or even within a day or so. It can, span over the course of a week or two, or even a little longer. More gradual change might be required for individuals, particularly those that might have had a very low fiber diet prior to having an ostomy. And in doing this, making sure that you're staying hydrated well. So making sure that you're consuming adequate fluids throughout the day, as fluids play a big role in how well we tolerate and break down and digest different types of fibers. If you're having a hard time getting bulk in your ostomy bag, hitting your fiber goals, soluble fiber supplementation in the form of Metamucil or Citracel or Benefiber, it might be warranted. I still recommend discussing with your healthcare team before introducing something like a bulk laxative or fiber supplement, and certainly discuss with your healthcare team before adding in a medical laxative, as constipation or decreased output or hard output can also be potential warning signs of something more serious like a blockage or a bowel obstruction. So firstly, discuss those strategies if you're really having a hard time with output with your team. So, we've talked about kind of managing output for the most part. Another complication that we want to avoid is complications around the stoma site. So, making sure that we're consuming adequate nutrition, especially in the form of protein, to make sure that we're experiencing adequate wound healing after surgery, but then also that we're well nourished enough to prevent in combination with good site care, skin breakdown around the ostomy bag. Protein is a very important nutrient for healing after surgery, also serves as a building block of the immune system, which can be quite helpful in recovery and maintenance. So in general, some of the more well-tolerated protein sources are going to be things like lean protein, like in the form of poultry, fish, eggs, tofu, smooth nut butters, or the derivatives of nuts, for example, nut butters, almond meal, almond flour, or coconut flour. Low-fat dairy is tolerated, or dairy-free alternatives. Typically, some of the lower lactose dairy, such as hard-aged cheeses, as tolerated due to some of their odor-producing potentials. But Greek yogurt is a good high-protein, low-fat, also low-lactose dairy option. But if you don't do well with dairy in general, you could choose something that's coconut milk or almond milk as an alternative. Vegetarian meat alternatives that are soy-based can also be good protein sources, and then hummus as tolerated as a pureed bean alternative compared to intact beans because of their gas-producing potential. And then lastly, how can we prevent nutritional deficiencies and complications? So if you've been guided to kind of take a multivitamin to supplement and fill in the gaps in your diet, sometimes a chewable or liquid form can be better tolerated. And then outside of just multivitamins, sometimes different vitamins in general are better tolerated in different forms. So for example, patients with an ileostomy, because they don't have that portion of the small intestine to even absorb dietary B12, you might require another form, either a tablet that dissolves underneath the tongue or an injection weekly or monthly. So that would be something to discuss with your healthcare team. Also being intentional about what oral nutrition supplements you were taking, and that includes protein shakes and protein drinks. So for example, on that last slide, if you're having a really hard time hitting your protein goals, it might be appropriate to add in, a Boost or an Ensure or an Orgain or a Kate Farm shakes to help fill in the gaps, but we certainly want to choose one that's not going to worsen or contribute to some of the output issues that you may or may not be experiencing. So for some patients, the higher sugar traditional oral nutrition supplements might be problematic, and they might experience more benefit from something that's high protein, but a little lower sugar, like an Ensure high protein or a Boost high protein. And then the oral nutrition supplements or nutritional supplements also includes some of the other supplements that you can find on the shelves, including complementary medicine, herbal medications. I always recommend firstly discussing that with your healthcare team. For vitamin and mineral deficiencies proactively and regularly is crucial to help prevent complications and catch those deficiencies early. And working with a registered dietitian can be quite helpful to achieve that. And then also making sure that we're meeting your nutritional needs and really tailoring a diet plan that's going to work well for you and hopefully be one that you'll tolerate and find sustainable. If you are having difficulty getting connected with a registered dietitian or finding one in your area, there's tool databases that are listed on this slide. One is from the Academy of Nutrition and Dietetics, and then the second resource is from the International Foundation of Gastrointestinal Disorders. On this slide, you'll find some excellent resources. The UOAA, the United Ostomy Associations of America, has so many great resources for ostomy patients, as well as the Grateful Patient Foundation and the Crohn's and Colitis Foundation. So with that being said, I hope you all found this helpful. You learned something new tonight. Thank you so much for joining me. If you have any questions or concerns, please send us an email and I'll be sure to get back promptly and hopefully get you an answer.